Hello, I'm Jennifer Martin, host of Franklin County Home Health Agency's Where the Heart Is. Franklin County Home Health Agency is a nonprofit home health care organization that has been caring for people of all ages throughout Franklin County since 1969. While its programs and services have grown dramatically since its beginning, its commitment to our community remains as strong as ever. We are proud to bring you this show that is dedicated to educating you on the programs and services of Franklin County Home Health, as well as offering helpful wellness tips to help you stay safe and healthy at home. On today's show, we'll be learning about a voluntary, free maternal and child health care program that partners low-income, first-time mothers with caring nurse home visitors. The program is known as Nurse Family Partnership. Nurse Family Partnership is an evidence-based community health program with outcomes that include long-term family improvements in health, education, and economic self-sufficiency. Nurse Family Partnership empowers low-income, first-time mothers with the confidence to create a better life for their children and themselves. The program is a national program that began in our country 30 years ago and now serves families in 41 states as well as in countries throughout the world. So we are very pleased at Franklin County Home Health Agency to bring this outstanding program to our local community through a program called Franklin Lamoille Nurse Family Partnership, which was launched earlier this summer. So with me today, I have two guests from Franklin County Home Health Agency, Rhonda DeRocher, the nurse supervisor, and Lisa Hardy, registered nurse with the Franklin Lamoille Nurse Family Partnership. So thank you both for being here today. And if you wouldn't mind, just start by telling us a little bit about yourself, Rhonda, your history in nursing, and what brought you to want to care for families like this.
Hi, Jennifer. Thank you very much for having us. And you did a very good job talking about our program. My name's Rhonda. I've been a nurse for 19 years. The last 10 years, I've been a home health visitor doing maternal child health visits in the central Vermont area. And before that, I was on a pediatric unit. So pretty much I've been working with moms and babies for a long time.
Your whole nursing career,
yes.
Mostly, sure.
Mm-hmm.
And Lisa, how about you?
Well, I've been a nurse for 11 years, and most of my experience has been in the hospital in maternal child health, and I've also worked for the health department for 4 years, doing a lot of women's health. And my background is I have a master's degree in nurse midwifery, so I'm also a certified nurse midwife.
Great, so definitely have all the knowledge that's appropriate for this kind of program. But what brought you in your early years when you were thinking about nursing? What inspired you to work with families and mothers?
Well, I just remember in nursing school going through the pediatric and the OB rotation, and I was really very just amazed at how women and children kind of deal with health and with illness, and I knew then that I wanted to work with moms and babies.
Nice.
And I was really interested in providing a holistic kind of health care, and I felt like that was something that families and new moms and babies really could use, and so that was something that I felt strongly about, and that's something that I feel like this program provides as well, which is part of the reason why I really wanted to.
Certainly, it's well-rounded.
For it, yeah.
So let's talk about that. What are the goals of Nurse Family Partnership?
Well, our overreaching goal is just to provide support and education to new moms, to first-time moms, and but more specifically, to work with them to determine what they think is going to be a healthy pregnancy for them, and help them reach that goal, and to so that they have healthy outcomes for their pregnancy. Having babies too early, we know, can be pretty devastating. So we work with moms to have healthy pregnancies. And then once the baby's born, we work with families to get the child ready for school, and just provide them with a lot of education to have healthy children. And then, and as the family as a whole, just helping them become more self-sufficient. Going back to school and working is the goal of a lot of women, after they have a baby. And so we provide them with the resources to help them reach those goals.
That's a pretty amazing program. Like you said, it's holistic. It starts from prenatal.
That's
so
right.
before the baby's born. There's so many programs that are valuable and wonderful for families, but they tend to focus on one or the other. And this is nice because it's a nice long streamline throughout the process. And like you said, pregnancy, childcare, and then their own self-sufficiency or what they can do financially for their family. So it's a pretty unique program, I would think, in this area. So thank you. Let's talk specifically, if we could, about, well, first, who does the program serve? Who is this designed for, and what do the families look like that come to this program?
Well, we focus on women who are pregnant with their first child, who are low income, Medicaid eligible, and we like to enroll women before their 28th week of pregnancy. So we do like to start out as early in the pregnancy as possible, and then, move on. And of course, the program is pretty intense. We do like to work with families until the child turns 2. So it really, truly is a nurse-family partnership.
It sure is.
We partner with these families.
Who sees somebody that long for, you're talking almost 3 years, that you'll connect, Lisa, with families. You both make home visits? Will you both do that?
Yes, we do.
I should mention, too, we have another nurse at Franklin County Home Health before we get going, Krista Zabriskie. So we have a team of 3 in this program right now. Okay. And before I go too far, too, it's called the Franklin Lamoille Nurse Family Partnership. Can you talk about that partnership?
That's right. Well, we serve both Franklin. It's Franklin County Home Health is sort of our home, and that's who oversees the program, but we serve Franklin County and we serve Lamoille County. Lisa is going to be predominantly in Franklin County. That's going to be sort of her home base, and then Krista will be in Lamoille County.
Okay, nice. That's
and
really
I kind of cover both, as needed.
So if people are in Lamoille County, they would still call Franklin County Home Health Agency for information and.
Well, they would call Lamoille Home Health at 888-4651. They would call Lamoille Home Health, and then they have, like we've set it up with them, that they have a process where they
so
do.
There's a liaison there. So that's nice because they're comfortable with their own local county and they can get the information there.
Exactly.
Okay. So again, that's Lamoille County would be the phone number for them?
888-4651.
Okay. So if we have viewers who know somebody in Franklin County or in Lamoille County, we hope that if they know people who, or they themselves are experiencing this or going to be pregnant for the first time, to call one of our agencies and ask about this program. So what this low-income first-time mothers, what's unique? What are the challenges and risk factors involved in that situation?
Well, first-time moms have a lot of questions, second-time moms have a lot of questions. But when you're a first-time mom, I think we can all relate that, you have a lot of questions. And going toward the low-income piece, more specifically, I see transportation might be an issue for a low-income first-time mom. Getting to prenatal visits, that's something that we can work with moms to provide, to get transportation.
You won't provide that transportation, but you'll help them find those resources.
Yes, we'd help them find the resources. There are resources in both Franklin County and Lamoille County that help with transportation to medical appointments, and we would help them secure transportation if that's an issue. Prenatal visits are very important for the health of the pregnancy, so we definitely want to work toward that. And also nutrition is another issue that might be challenging for a pregnant mom. She has to have more calories. Yeah, she's feeding a baby, so she has to have good nutrition. And so that can be difficult because I think that eating more nutritiously can sometimes be more expensive, so we can also help them find those resources. And then probably the third challenge that I see a lot is housing.
Yeah.
I'm pregnant, this is my first baby, now I'm going to be responsible for another life, up until this point maybe, like we work with a lot of women who are or have been in the past homeless, so we definitely want to work and help those moms secure some housing that's safe.
Good. So you're finding a lot of resources for a lot of challenges, and different challenges.
Yes.
For sure. And what kind of care is provided specifically? This sounds, you mentioned prenatal care, they would go to the doctor for specific prenatal care, but talk about the kind of care. I guess this is a big question because you have a long time that you're with them, but if we could kind of look at it as what kind of services are provided in pregnancy and then through the next couple years.
Well, it does depend on where they're at, in their pregnancy. Early pregnancy has different, women have different questions in early pregnancy than what they have in late pregnancy. And of course, once the child's born, they're going to have a whole new set of questions, so it depends on where they're at. But typically a visit is is we go in and we do like your typical nursing assessment, blood pressure, vital signs, checking weights and heights and those types of things. And then we sit down and we talk to the family about what do they want to talk about, where they're at, that day, what are their questions, and that's kind of where we go from.
About how long are you with them with visits?
A typical visit lasts between an hour and a half, and I've been finding that it is between an hour and a half for a typical visit. So
That's a lot of attention that they can get. We certainly have a lot of good care in prenatal care, but sometimes you don't get that long of a time to have all your questions
That's
answered.
right.
Sure. Talk about you are doing stuff that does happen in the doctor's office as well. Is there medical care that you're providing, or is it mostly this working with resources and answering their questions and helping them find their way?
That's a really good question, actually, because the purely medical piece, like wound care, and if the baby's sick or something like that, we do refer them to the appropriate source, of course, but we don't typically work with those sort of those high need medical.
Okay, good. But you, being nurses, you can catch those things early on, so that you can refer them to, or let their doctors or healthcare team know. So that's really important that you're a nurse who can see those things. That's the benefit of having that nurse-family partnership.
That's right. That's right.
So that's prenatal care. You've got a lot of questions. You mentioned the family. So how is the family involved in that? The father or other care providers and extended family, how are they a part of this partnership?
Well, we know that family support is really important to first-time, or to any mom, but to first-time moms. During our first or second visit, getting to know mom herself, and then we absolutely welcome any other member of the family, as long as mom's comfortable with
Sure.
it,
So
to
she
be
can
a
have
part.
whomever she wants there.
She can have whoever she wants to at the visits, and it doesn't have to be necessarily a family member, a good friend, or her, who are your biggest supports, and who do you want to be a part of these visits and take this journey with you.
Yeah, good. How often do you visit? Once you start the care, you said again, try to get it before 28 weeks, and you start visiting. What's your visit schedule look like?
Well, the first 4 weeks we do weekly visits, and then we kind of cut down to every 2 weeks until the baby's born, and then we pick it back up to every week for 6 weeks, and then it goes every 2 weeks until the child is 2 years old. But it's really important to say that that's sort of like the optimal visit schedule, but really it's up to the family. If you're not comfortable with every 2 weeks, what are you comfortable with? If you need somebody every week during times, so we really listen to the families as far as that schedule goes.
Very flexible with
yes,
that.
we're really flexible.
Yeah, and they get busy with babies too, and
That's
things
right.
happen. So
and they
that's
go
good
on
to have flexibility.
vacation.
Sure. Yeah. Yeah, very good. No, they hope to.
Well, yeah, exactly.
That's wonderful. So the children, you talk about every 2 weeks once they've had a baby. What do those visits look like? Certainly
those
the
are
6
fun.
weeks are very unique, and then later. Do you want to talk a little bit about that, Lisa?
Sure. In infancy, we're sort of doing teaching a lot of infant care, answering whatever questions moms have. We do a lot of working with different types of feeding, breastfeeding, bottle feeding. When should I start feeding my baby solid foods, that kind of thing. And we have these babies. I brought along mine. We each have one, and we work with them.
Do you fight over them?
Yeah, we did actually.
And so we use these to interact with, and it's actually pretty fun. We do a lot of activities where we're interacting with our babies, and then we have role playing. We have the mom kind of do the same thing, and that helps sort of lessen the nervousness about it, and it's actually a lot of fun.
Yeah,
so,
I imagine makes it fun. Good. So are you lactation consultants, or you would again refer to breastfeeding
Well, I'm actually a lactation consultant.
Okay.
So, and Lisa's a lactation counselor, and she has a lot of experience. So, but if it was, aside from breastfeeding, if it was something that we wouldn't be able to meet their need, we would be able to refer them onto the appropriate service.
Okay. And so that's newborns, and then you have the young babies and the toddlers.
all the way up to the toddlers.
Yeah. And what kind of skills are you helping parents with there?
Well, with the toddlers, we sort of get into a whole new set of childproofing and how to play with your toddler. Toddlers play differently than infants do, and how much TV should I let my toddler be watching? What can I do with my toddler specifically? We get into those sorts of things. And then also, sometimes moms are thinking more about planning their family in the future. We talk about that. You know, once the baby gets to be a toddler, we can
Adding
talk more
another
about
baby
that.
and
Right, adding
the
another
impact it has on the
baby.
baby, sure.
Yeah.
It's wonderful. It sounds to me like there's sometimes I have been in that place of being a new mom, and there's a lot of resources, and you've got a lot of things to read, and everybody's telling you things on both sides of your family. It's nice to have this consistent person coming in that you can trust and build a relationship with, to bounce some of those questions off with as much as they can. I know I called my doctor's office a lot in the beginning. They were very good about answering, but how wonderful to know that you're going to see somebody come back and you can save some of those questions. Or maybe, and then you get to see it happening. So you see the child and the baby. So it's a little more than just listening to somebody ask questions, but you get to really be there and get a sense for the whole family.
That's right.
It's a great
Yeah, we
program.
really get to know people as individuals and individual families.
Yeah.
And in their home.
And in their
Yeah,
home.
in
Thank you.
their
I was going to
own
ask, is
home.
it always in the home, or can you arrange services? Is it mostly it's going to be right in their home, right?
Well, most of the time, but like I said, you know, we do work with women who are homeless, and so it doesn't have to be in the home. It is a home-based
Setting.
program, and we'd like it to be in the home, but there are times when that can't happen, so we can meet with women in other places, and it just depends on, you know, what's available.
Each person, sure. Again, this is a lot of information that you both have, a wealth of information available for families. Can you talk about the training specific to, you have great training and obviously your nurse backgrounds, but specific to nurse-family partnership, what did that include?
Yeah, well, because nurse-family partnership is a curriculum of sorts, you know, it's a little bit structured. We did have to, we have units that we had to go through. I have 4 units, and the nurses have 3 units. The first unit was just a workbook that we read about. It kind of gave you the background on nurse-family partnership and got you familiarized with all the language around it. And then we had to go to Denver and spend a week in Denver going through classes to learn how to support women, you know, during one of the most important and sometimes the most challenging time of their life.
That must have been fun to meet other individuals who are doing this kind of work. And it's nice to have that. It's a national program, so you have a set, you know, it's evidence-based, and there's some standards that you can and work to. So you're not recreating the wheel, but I'm sure, again, like you said, there's always individual situations, but it's nice to rely on a program that has proven results. So
that's right.
We're happy to have that here in our community. You've talked a lot about, we've mentioned a lot of collaboration with referring them to the right sources. Specific to Franklin County Home Health Agency, what resources are available for families in addition to nurse-family partnership?
As far as Franklin County Home